Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
What if keeping an eye on your stress was as simple as, well, your nightly routine? Imagine a world where just flossing your teeth could also tell you what's going on inside your body.
That's a really fascinating idea, isn't it? And it's exactly what we're going to dig into today. We know chronic stress, the kind that goes on unchecked, can really take a toll.
Yeah, it contributes to some serious health problems, both physical and, mental.
Exactly. And the tricky part is it's often hard to tell when everyday pressures are becoming something, well, more serious, more chronic.
Right. And the ways we check now, like maybe an occasional blood test at the doctor's office or filling out those questionnaires about how stressed you feel, they're not always that helpful or easy to do regularly.
And our own perception can be a bit unreliable sometimes, can it? We might think we're handling things fine when biochemically something else is happening.
That's a great point. It really highlights the need for ways to monitor things easily, frequently, at home. Ideally, tools that just blend into our lives.
Precisely. Tools that are accurate, of course, but also don't add more stress just by using them.
So that brings us to today's deep dive. Researchers have been looking into this really interesting idea: building a stress sensor right into a dental floss pick.
Something many people use every day anyway.
Exactly. We've looked at a health news article talking about this, and more importantly, the detailed scientific paper that describes how it was developed and tested.
So our mission today is to understand how this little gadget works, what it could mean for, managing personal health, and what the experts behind it are saying.
Okay, let's get into the study itself then. What was the main point of the research?
Well, the core goal was to create a really user-friendly way for people to monitor their stress hormone, cortisol, using saliva right in their own homes.
To get around the problems with current methods, basically.
Exactly, to make it more accessible and routine.
So this floss pick, it looks like a normal one, but it's got some smart tech inside. Can you break down the parts for us?
Sure. So you've got the floss itself, which is what collects the saliva sample when you use it.
Okay, standard enough.
But then this floss is connected to a tiny channel, a microfluidic thread, really thin. It automatically wicks the saliva away from the floss.
Towards the sensor.
Right, towards a flexible electrochemical sensor that's actually embedded right there in the plastic handle of the pick.
A sensor in the handle, huh? Clever. How does that sensor actually detect the stress hormone, the cortisol?
Okay, so the heart of it is this tiny electrode coated with a special material. It's called an electropolymerized, molecularly imprinted polymer. Bit of a mouthful.
Huh, definitely. What does that mean in simpler terms?
Think of it like making a microscopic custom mold. The scientists basically used actual cortisol molecules to create tiny, perfectly shaped cavities or imprints within a conductive film on the electrode.
Ah, I see. So they make little cortisol-shaped holes.
Pretty much. Then they wash the original cortisol away, leaving these empty pockets that are an exact match for cortisol molecules.
So when you floss and saliva gets to the sensor...
If there's cortisol in your saliva, it fits snugly into those specific imprints, like a key in a lock. It binds there.
Okay, it binds. And how does the device know that's happened? How does it become a reading?
Well, when cortisol molecules lock into those imprints, it actually changes the flow of a tiny electrical current passing through the sensor.
It interferes with the current.
It decreases it, yes. And the amount of decrease is proportional to how much cortisol has bound to the sensor.
Okay, makes sense.
This change in current generates an electrical signal, and that signal is then sent wirelessly, maybe to your phone or another device.
And the app or whatever translates that signal into your cortisol level.
That's the idea. Oh, and there's also a little absorbent pad inside the handle too, just to soak up the used saliva sample after it's been analyzed, so you can just dispose of the pick safely.
A neat, self-contained system. So the big question, did it work when they tested it?
Yes, they did quite a bit of testing. First, they used artificial saliva, where they knew exactly how much cortisol they'd added.
Controlled conditions.
Right. And the floss pick was sensitive enough to pick up even small rises in cortisol, the kind you might see with early stress. That was promising.
Okay, good start. What about real saliva?
That was the next step. They tested it with actual human saliva samples. And importantly, the floss pick's performance was right up there with a standard lab test called an enzyme-linked immunosorbent assay, or ELISA.
Wow, so it was as good as a common lab method.
In their tests, yes.
Yeah.
That ELISA test is often used as a benchmark for measuring cortisol accurately in saliva. So that comparison is pretty significant.
Definitely. How quickly do you get the result? You mentioned wireless transmission.
It takes about 10 minutes from flossing to getting a reading.
10 minutes. Okay, not instant, but faster than waiting for lab results.
For sure. And they tested its sensitivity, too. It can detect cortisol over a really wide range of concentrations, from incredibly low levels up to quite high ones. The actual detection limit in human saliva was very, very low, meaning it's highly sensitive.
And accurate. Did it measure the right amounts?
Seems so. When they added known amounts of cortisol to saliva, what they call spiking the samples, the device measured those amounts back with high accuracy, very close to 100%, and with little variation between tests.
Okay.
They also found it was consistent. Testing the same sample multiple times gave repeatable results, both with the artificial saliva and the real human samples.
All right, so the tech seems solid based on these initial findings. Let's shift focus a bit. What could this actually mean for us for managing our health day to day?
Well, I think the biggest potential implication is empowerment. Imagine having a simple tool to monitor your own stress levels, maybe daily, just as part of your normal routine.
Like checking the weather almost, but for your internal state.
Kind of, yeah. It could give you insights you just don't get from occasional check-ins or just guessing how stressed you are.
And that routine aspect feels key, moving beyond just snapshots.
Absolutely. If you could see your cortisol levels creeping up over days or weeks, maybe before you feel totally overwhelmed, you could take action sooner.
Like making lifestyle changes or maybe realizing you need to seek some support.
Exactly. Early detection could be really powerful in preventing chronic stress from leading to more serious health issues down the road, like heart problems or mental health disorders.
And just the method itself, using a floss pick, seems way less daunting than other options.
Oh, definitely. Compared to, say, regular blood tests, which can be inconvenient and even anxiety-provoking for some.
Yeah, I can imagine getting stressed about getting my stress tested.
Right. Or even wearing some kind of bulky monitor. A floss pick is familiar, it's discreet, it's unlikely to cause stress just by using it.
That's a really practical advantage. And didn't the researchers mention this tech might be useful for other things too?
Yes, they did suggest that the underlying sensor technology, this molecular imprinting approach, could potentially be adapted to detect other important molecules in saliva in the future.
Oh, interesting. So not just stress.
Potentially, yes. It could open doors for other types of convenient, non-invasive health monitoring using saliva. This is part of a bigger trend towards what's called point-of-care diagnostics.
Bringing the lab tests closer to the patient or even into their homes.
Exactly, making health monitoring more immediate and accessible. And think about integrating this with mobile health apps.
Ah, right. So you could track your levels over time, see trends.
Maybe get insights or alerts from an app based on your patterns. There's a lot of potential there for personalized feedback.
That does paint an exciting picture. But okay, let's be balanced. Like any new tech, there must be some limitations or things to keep in mind.
Absolutely. It's important to look at those too. We mentioned the time, 10 minutes for result is pretty good, but it's not instantaneous feedback.
Right. Still a short wait.
Also, each flog pick is single use, disposable. So if you're testing daily, there's an ongoing cost and, well, waste to consider.
Good point. And it only works if people actually use it, right? Like, remembering to floss is hard enough for some folks.
User compliance is definitely key. Building it into an existing habit helps, but people still have to consistently do it for it to be effective.
True. What about interference? Could other things in saliva mess up the cortisol reading?
That's something the researchers looked at. They mentioned that, theoretically, other molecules with a similar shape to cortisol could potentially bind to the sensor.
Ah, so false positives, potentially.
Yeah, it's a possibility they considered. However, they specifically tested several common substances found in saliva, like progesterone, testosterone, glucose, urea at typical physiological levels, and they found very minimal interference from those substances. So while the possibility exists, their tests suggested the sensor is actually quite selective for cortisol under normal conditions.
Okay, so the risk seems relatively low based on their findings.
That's what the paper indicates. And finally, the researchers themselves noted areas for future improvement, like making the electronic components even smaller, maybe integrating them more seamlessly, perhaps to make it even easier to use.
Always room for refinement. Okay, so we've looked at the tech, the potential, the limitations. What did the scientists who actually did this work say about it, their perspective?
Well, they seem very encouraged by the performance. They stated quite clearly that they believe this is one of the best performing cortisol sensors reported in the scientific literature so far.
That's quite a claim.
It is. They really highlighted the novelty of their approach, managing to integrate a sensitive electrochemical sensor into something as commonplace as a floss pick.
Yeah, moving it out of the lab and into the bathroom cabinet, essentially.
Right. And they obviously placed a lot of importance on that comparison with the ELISA lab test.
The fact that it performed similarly in real human saliva must have been a key finding for them.
Absolutely. That comparison lends significant credibility to its potential as a reliable tool for people to use at home. They also pointed to the design features, like that microfluidic thread.
The bit that wicks the saliva.
Yes, they noted that that helps minimize interference and contributes to the sensor's consistency and repeatability. And of course, the wireless readout is crucial for convenience.
Making it easy for someone to just get their reading without needing complex equipment.
Exactly. The focus seems to have been on creating something not just accurate, but genuinely practical for regular real-world use.
It certainly sounds like they've thought about the user experience.
It seems that way, making stress monitoring potentially as routine as dental hygiene itself.
So, as we wrap up this deep dive, it really does feel like we could be looking at, well, maybe the start of a new way of thinking about personal health monitoring.
It definitely raises a provocative thought, doesn't it? Could our simple, everyday actions, things we already do, become windows into our health?
It makes you wonder, if you had access to this kind of real-time stress data day after day, how might that change how you understand your own body, how you manage stress?
And you can let your mind wander further, can't you? What other everyday items could potentially house sensors like this? Toothbrushes? Wearables are already there, but maybe even simpler things.
Lots to think about.
Indeed. For now, this innovative dental floss pick gives us a really fascinating glimpse into a possible future one, where technology integrates quietly into our lives to give us proactive insights for our well-being.
Thanks for tuning in to the Health Headliner podcast by Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.